I chose to do my presentation over a brochure covering cardiovascular disease that affects the American Indian and Alaskan Native populations. Cardiovascular disease is the leading cause of death among American Indian and Alaska Natives. As a tribal member of the Cherokee Nation, I am a member of the population that is affected by this issue. So it's important for us to understand the effects of heart disease, and because it not only affects Native Americans, but a majority of other populations as well. The objective of my brochure is to pinpoint risk factors and encourage managing techniques tailored to American Indian and Alaskan Native populations. This brochure defines heart disease and its causes, as well as risk factors associated with the disease, and finally, management points and techniques directed at this population. So let's go over the definition of heart disease. The term heart disease refers to several types of heart conditions, the most common in the U.S. being CAD or coronary artery disease, which affects the blood flow to the heart. Decreased blood flow can cause major damage to your heart and further complications. If left untreated, CAD can reduce blood flow and plaque in your carotid arteries and may result in stroke. If plaque buildup takes place in these arteries, you're at risk for a heart attack. So now that we know the definition and the effects of heart disease if untreated, we can talk about the risk factors. As with the general population, there are several risk factors of heart disease, including diabetes, obesity, unhealthy diet, physical inactivity, and excessive alcohol intake. The rates among Native Americans and Alaska Natives is higher within this population for these complications. The colonization of European colonization is a contributing factor to these health disparities, as well as increased risk factors in these populations. Prior to colonization, the makeup of tribal diet was usually based on plants and animals. Their adaptation to available food sources increased changes in their diet that caused these factors to become a bigger role for them. Researchers believe that many of the risk factors may have increased among Native Indians because the culture changes that have taken place over the past 50 years. So, after discussing the definition and risk factors, we can discuss management techniques for the population. Tailoring management techniques to this population can help reduce the prevalence. So services for prevention and management are made easily accessible to this population through their healthcare services departments. Indian Health Services offers health and wellness programs for American Indian and Alaskan Native populations. Also, Cherokee Nation Healthy Nations, as well as Cherokee Nation Diabetes Prevention programs, are aimed at helping the local community in an effort to decrease risk overall. Information for both entities is listed on the brochure. And this is the brochure. Here it talks about the disease. Here are the risk factors. And then here are some ways to manage. This is the prevention programs that we went over, as well as links and phone number information where that information can be obtained. Thank you.